Hi, welcome to Health Talk with Nicole and Dr. Martha. I am Nicole Tatro, and today we want to talk a little bit about those winter blues that we're all having. Personally, I feel like it's been a very exceptionally cold winter here, and I know with the children, they haven't been able to get outside as much as we usually do. I bought my daughter ski pants and we've hardly even used them. And I am feeling it a little bit. I'm feeling a little bit depressed, to be honest with you, and just blue. So today I brought with me Mitch Pelkey, who is a licensed clinical social worker as well as a fellow integrative nutrition health coach. And I thought maybe she could give us some tips to get through the next few weeks, hopefully just a few weeks of this long winter. Welcome, Mitch.
Thanks for having me, Nicole.
It's a pleasure.
So you're not alone. I'm hearing this in my practice and just in the grocery store, all over the place. People are feeling blah. There's a difference between the winter blahs and depression, but I think what we're going to focus on are just this blahness that people are feeling. And part of that is coming from not having enough sunlight. And it doesn't mean that you need to go out and sunbathe. I think you and Jess were able to make it out the other day, sit outside because it was warm enough and sunny. But you can even get sun in your car, in your home, anywhere, in your office. As long as you have windows. But try and grab as much of that as possible. And we really only need about 20 minutes a day. I think that, it's even hard for people to put that in because of how cold it is. But if you can do it outside, it's even better, but any sunlight is good. We produce melatonin when it's dark, and that causes us to feel sleepy. And we want to take a nap instead of go out and do, say, snowshoeing or cross-country skiing or even building a snowman.
Well, that's what I was exactly going to say, is that a lot of my patients are coming in and beside the fact of feeling a little bit down, they're extremely exhausted. And I've noticed that once 3 o'clock, 4 o'clock hits, I'm struggling to keep myself awake, and I consider myself fairly active.
And that's because of the sun.
Yeah,
right.
And I actually, I have my office has a lot of windows in the front, but my actual office does not. So I've actually found myself gravitating towards the front to do my notes and everything. So It's almost like we have a natural instinct to do
exactly.
that.
I was going to say, it's an instinct to go towards the sun, just the same way that a plant does. You notice the plants that you're building are heading in one direction, and that's right towards the window and away from the dark. So, and as far as the kids, I think that we can just bundle them up. And we've gotten in this habit of TV and video games and those types of things, and not really forcing the kids to go outside. Obviously at 20 below, you don't want them to get frostbite, but again, even 20 minutes of building a snowman or even sending them out to help do some chores, like we all have to shovel our walk, those types of things. You could even ask them to get the snow off your car, go get the mail. I know it seems like a lot to bundle them up to do that, but they're really going to benefit from doing that. They're going to move their bodies, they're going to get the sunlight, they're going to also feel good about themselves. And that's another piece that we need to do in the wintertime. I think a lot of people just kind of hibernate and don't try to do anything new and different, and I think that's one of the things that you've been talking about on your blog, is stepping out of your comfort zone. So whether it's trying cross-country skiing, snowshoe, anything that you could possibly do outside. And I don't know when the last time it was that you made a snowman.
Yeah, exactly. I know my daughter yesterday couldn't wait to go out to make a frozen snowman. She wanted to make Olaf.
Nice.
So it did. But yesterday was exceptionally warm for what it's been recently around here. So it has been a struggle, I have to admit. And I've done the same thing. I've kind of wanted to cuddle inside. We're a big hockey family, so we spend a lot of time in a cold rink, but it's not the same.
Cold, dark rink.
It's dark, and we're not, getting the sunlight. So what are your thoughts? I have actually had a couple of patients come in, and I think one of the names is like a happy light, or those natural sunlights. It's not a tanning bed,
right?
But it's one that you can personally buy. Have you had any experience with that?
Absolutely. I use one myself. I really enjoy it. They're even prescribed by physicians oftentimes and psychiatrists.
I didn't know that.
So even some people who are prescribed medication for depression, science has proven that that helps the serotonin levels release.
Oh, I'm so excited because I have to admit I ordered one on Amazon yesterday.
Good.
And they're fairly reasonable.
Right.
So
Right.
most anybody can get in hold of one.
What type of research did you do?
I haven't really done, I read a lot of the reviews, so I know
Okay.
that's just personal.
Okay.
And I have heard about light therapy in the past, but not a whole lot of scientific research, so I was curious to see if you had any of that. But I do have 2 patients that come in and rave by it. They do say that they had to get a little bit of their personal experience. One can only handle about 5 minutes at a time. And she, so I guess you probably have to play around with it.
We need to look directly into the light. So for someone with lighter eyes or sensitivity to migraines or sensitivity to light, it's a little bit more difficult for them. So they do have to, just like a muscle, you have to work up to it. There are also light boxes that you can have in your office, in your home, that you don't necessarily have to look directly into, but it's natural sunlight. So which did you get?
I think that's the one that I got.
The natural sunlight.
It's something that you can actually put in your office and have right next to you. So I'm really excited.
Good. Good for
so
you.
I'm glad we talked about that. Wonderful.
And you did mention tanning beds.
Earlier we were saying, gosh, if only, because I get really pale and it's almost like hand in hand. I'm like, oh, it's the whole aesthetic thing. Like I'm pale and I'm ghostly. And then with that becomes the kind of not feeling great. So the easy solution, especially my clinic's right next to a fitness center, would be to go over in the tanning bed. But we all know that that's probably a no-no.
Yeah,
so tell me a little bit, like, what's the difference for people that might not know?
So you don't get tan from these lights.
Right.
It's really releases the vitamin D. And yes.
So the reactions, the chemical reactions that are happening.
It's not like
the good chemical reactions.
Right. The 70s, I think they used to have like tanning lights kind of
all
thing.
around.
Right. This doesn't affect your skin, and then it
so
doesn't have
safe.
the risks. Right.
Wonderful.
For skin cancer.
Good. So it's a good option for people that, with us that live up in the Northeast like this.
Absolutely.
Wonderful.
And what have you done recently about just playing?
Well, again, a lot of it's inside stuff. We try to get out and walk a little bit, but we've been really bad with that.
Right.
And I think I'm falling in the same trap, And that's what I claim to be, is very authentic. I am real. I'm just like everyone else. So I haven't gotten out there. And when I'm driving and it's like 0 degrees out and I see a runner, I'm just so proud of them. And then I get jealous because they're out there and they're doing it.
And releasing those endorphins.
Exactly. So I'm embarrassed to say, but I haven't done a whole lot. I am playing hockey, the Moms League, but again, it is inside. I am doing stuff, so I think that's helpful to get through the winter.
So you're releasing.
Exactly. I was going to say, I don't think it's only about getting the sunlight. I think that it's about staying active as well.
Right.
So I am proud of myself there. That was something new that I started this winter.
Absolutely. Endorphins.
Yeah, exactly.
And I think that you also feel proud of yourself. And that's a big blues beater, is when we can find some joy. So when you're talking to your clients, encourage them to find joy. It could be anything. Obviously some people just really don't want to brave the cold, but there are art classes. There are so many different things that we could do to feel good about ourselves, as simple as a nice warm bath. But we want to
my baths.
Right. But we want to release that serotonin as well. And so I think that's why you're doing a little bit better, because you have a lot of great projects going on and you are active.
I think self-care is huge.
It is really
and that's
huge.
Something that I've focused on this year, with trying to project that out into the community. Self-care, it's not being selfish, it's actually doing well. It's like putting the oxygen mask on yourself first. You got to take care of you.
Absolutely.
And then you can help take care of all the people around you.
Absolutely.
So, wonderful.
One of the things we didn't talk about is the change in diet once it starts to get cold.
It's awful hard up here.
It is.
I have colleagues and friends and people I study with that are, in Florida or even in California, and they're always talking about, their produce, and I kind of get a little jealous. I mean, we do have options.
We do have options.
So I guess maybe we should talk about those options.
Right. So traditional comfort foods tend to be less colorful. and more hearty, more starchy, a lot more sugar. And so if we can replace the sugar, even a little bit, because we know that sugar causes crashes, which also feel like depression. If we can...
roller coaster up and down.
Absolutely. So even a simple step as reducing, changing a potato for some spinach, just adding the leafy greens in, because we know that they have a detoxifying nature to them, and if we can add more of that, just more color, whether it's in the way you dress and the way you eat, and that really helps.
I know what we do in our family to sneak those in for the kids is a big smoothie drinker. So
that's wonderful.
We sneak those in, and lots of spinach and leafy greens, and then we disguise it by putting in some lemon juice and then an apple, and that sweetens it up enough for them to be able to take it in as kids. And personally, it's something I do every single morning. So I think that's got to have helped me.
Absolutely.
Amongst, obviously, it'll be a whole nother topic one day, is the detoxing properties, just to get the yucky stuff out.
Right. So it helps you not be so sluggish.
Absolutely.
And that's wonderful.
And I think the hardest thing for people is that it's not a one-time thing. This is a daily process.
Absolutely.
You need to take care of yourself daily. And I think that's what is the hardest to educate people. It's not just a quick pill that you can pop and think that everything's going to be fine. It's a process, and it's something you have to work for.
Right, and we can. It's easy to find all the negatives about the cold, but we are really fortunate.
I've fallen in that trap lately. I'm sick of it. You will not find me complaining when it's 90 out. I'm even okay when it's humid. It's not pleasant, but I will not complain then. But I have been falling in the trap of complaining lately. It's just hard bundling up the kids, and I'm freezing, and my hands are cold. But we're getting through it.
We have heat in our cars.
Yes.
We have the sun, and it really is starting to come out. One thing that people might notice, we're going to change the clock again, unfortunately. So I think people were starting to be able to get out of bed a little bit easier because the sun was rising earlier. So just be patient. It's not going to be like that for too long, but people will be driving home in sunlight. So we're coming a little bit towards the end of our show, but to wrap up then, so I'll say people should explore maybe looking into the natural lights. Yes.
Very affordable, and they should get out and move, get some sun, even if it's in the window. I, the other day, put my face up to the kitchen window. It was quite awkward and funny if you were a fly on the wall. And also, watching what you're eating, trying to get in some green, or leafy greens, I should say, colorful foods.
Colorful.
I think that's safe to say.
Absolutely.
So that should get us through the next few weeks of the blahs.
Wonderful.
Well, Mitch, I really appreciate you coming by today. It's been a pleasure.
Thanks for having me.
And I hope that we've been able to reach a few people out there.
Absolutely. Thanks.
So if you have a question for us for Health Talk with Nicole and Dr. Martha, please visit the website www.elitehealthandwellnessvt.com. We have a section over to the right where you can submit a question, and we will try to answer your questions live on TV here at the station. Thank you for joining us today, and have a great day. Have a happy and healthy day.